talking about medical weight loss to start this conversation, semaglutide and tirzepatide are those two injectable medications that we regularly use for this. What semaglutide and tirzepatide are, they are both GLP-1 agonist medications. They were previously used as anti-diabetic medications. They had brand names, Ozempic and Mounjaro, that you could get from your physician or your endocrinologist and then pick up at a standard pharmacy. But now they're more regularly being used as a weight loss medication. Due to the shortage of those medications, we are now able to offer compounded versions of those medications that we utilize through a FDA regulated compounding pharmacy. How these medications are going to initially work. The first thing you're going to notice when you're on a GLP-1 medication is decreased appetite. Just within those first few weeks of taking the medication, you're going to notice your appetite is significantly decreased. You're going to have smaller portion sizes, just kind of naturally, lower caloric intake without really putting a ton of effort into it, just because you're not necessarily wanting to snack as much. Other things you're going to notice, and this tends to happen over time, not necessarily something you notice right off the get-go, but decreased inflammation. We can sometimes see that in your blood work and your lab work. Other times people will start to notice that, even though they haven't lost as many pounds as what they were anticipating, they're fitting in smaller clothes because their body is just having decreased inflammation. Some people that have issues with joint pain or sometimes issues with migraines, issues that come from inflammation, chronic inflammation in the body, they may notice that those things start to improve while being on this medication as well. It's also regulating certain hormones responsible for weight gain and slow weight loss. Things like ghrelin and leptin are specific hormones that are responsible for appetite and digestion. Also, sometimes your thyroid levels will balance out and normalize a little bit while being on this medication as well. And then delayed gastric emptying. So this is, again, kind of the mechanism of action for this medication. It slows down how fast the food's moving through your digestive tract. And what that means is it typically is just going to make you feel fuller for longer. The food that you eat is going to stick with you for longer. It's sitting in your stomach for a little bit longer, so you're not necessarily feeling as hungry as you're used to. So again, the common GLP-1 medications on the market are the semaglutide and the tirzepatide. Both of these medications, they're given weekly, and that's an at-home self-injection, or we can offer those in office, and we'll talk more about that here shortly.
Okay, so why would you consider compounded medication for treatment? So one of the things, Dr. Diedrich is our doctor here at MidAmerica, and he has a surgery requirement, a BMI surgery requirement. And so it's helpful for those who need to get their BMI lower for their surgery goals. Other patients who might want a compounded medication would just be for an aesthetic reason. So you're wanting to lose weight and maybe you're having kind of slower weight loss just with diet and exercise alone. So compounded medications can help with that. Other patients we see are patients who kind of bridging the gap with those name brand medications that Taylor was talking about. Those are in short supply. And so we have patients who come in who are unable to get those at their regular pharmacies. And so they come in to get the compounded version. So that way there is no gap in their care.
So talking more about that administration of medication that I was talking about previously. So typically it's self-administered, very easy to do. It's one subcutaneous injection per week in either the abdomen, thigh, upper arm. What that means, we're kind of finding the fatty area and injecting just very superficially into the fat. It's not a very deep injection. The needle is teeny, teeny, tiny, so most people don't even feel it as it kind of pokes through the skin. For those that maybe are unable or unwilling to self-inject, whether it's a needle phobia or just not having the comfortability of doing that yourself, we do have the option of doing an in-office injection. That does come with an additional fee, and we are going to talk a little bit about pricing here in a few moments. But that is something that is also available for patients that maybe are not comfortable self-injecting. And then dosing. So every single patient's dosing is going to be customized and individualized for what you need. It's determined by your provider. So between myself, Caitlin, and then our other provider, Ashley, we kind of come up with the dose that's necessary for you to achieve your goals. The goal is to basically increase slowly and continue increasing until we find your ideal dosing. For some people, that does take several adjustments. For other people, they start to reach that ideal weight loss about 1 to 2 pounds a week with very little to no side effects at very small increments of doses. So we just kind of come up with whatever we need to do with your specific needs.
Common side effects. This is a big question I get a lot just with people who maybe have read things online or hear people who are sick and miserable on things. So the biggest side effects that I even see personally in our patients are going to be nausea and constipation. The nausea tends to be one of two things, though. It's kind of more that feeling to where your stomach is just kind of so empty that you just need to put a little bit on it, whether that's crackers, bananas, toast, things like that. And that nausea kind of subsides. Or on the flip side, if people overeat or if they eat big, greasy, fatty meals, then they kind of feel a lot grosser. Constipation, that's kind of the same. It kind of comes more from eating less than it does necessarily the medication itself. So we give you some tips and tricks to make sure that that kind of stays away. Other things people experience: bloating, indigestion, headaches, dizziness, fatigue. Again, we give you lots of tips and tricks at your initial consultation to kind of help make sure that these are minimized.
And all these side effects, they're very temporary and very easily managed, like Caitlin was saying. So it's more common to experience these side effects when you're either first starting the medication or when we do adjust and taper that dosing up a little bit. Like she was saying, though, tips and tricks. We have lots of things we can do to dramatically minimize your side effects. Proper nutrition. So we talk about fiber intake goals, protein intake goals, water intake goals, and then also supplementations, vitamins, minerals, over-the-counter medications, and then also some in-office things that we can offer, such as IVs.
So who is eligible? We were kind of talking about Dr. Dietrich's BMI requirements. We do have BMI requirements for our program as well. So this medication is targeted more towards for patients who have a BMI of 27 or higher, and who are looking to lose approximately 12 to 20% of their total overall body weight. That being said, just because you meet that requirement doesn't mean there's other contraindications. So you wouldn't want to be pregnant, breastfeeding, or trying to become pregnant while on this medication. There is a contraindication for a family history of medullary thyroid cancer or endocrine neoplasia syndrome type 2. History of diabetes, that's not necessarily a contraindication, but we would want you to follow up with either your primary care doctor or your endocrinologist prior to starting therapy with us. And that's also because you might be able to get that name brand medication covered under insurance. But since we are not endocrinologists, we want to make sure that they are following those numbers appropriately while you're on this medication. Other contraindications: history of pancreatic disorders, kidney, liver disorders, or history of suicidal ideation or severe clinical depression. And we're really just wanting to make sure that you are at your healthiest when you're starting a new medication. That's what I got on that.
Yeah, and I always tell people too, when it comes to this, like there are our green flag patients, our yellow flag patients, and our red flag patients. So, a green flag are going to be our healthy patients. Lab work comes in great. We do require lab work for this, and that's something I don't think we talk about anywhere else in this slideshow, but we do order labs for you, whether you've gotten them already and we'll reevaluate those from your PCP, or if we need to order them for you, we can do that as well. But, everything comes back looking normal. They're at that BMI of 27 or higher, and, they kind of hit those goals on what we're looking for in an ideal patient. Then we have our yellow flag patients. And yellow flags are going to be things like the history of diabetes, history of pancreatic disorders, kidney or liver disorders, and then, some of that depression. Yellow means, it doesn't mean stop. It means pause. We need to reevaluate, maybe dig a little bit deeper into your medical history and determine if you are still a good candidate. So it's not that you can't do it. It's just that we need to dig a little bit deeper. That also comes from the thyroid cancers. Specifically MTC, that medullary thyroid cancer, is the red flag. That is the one that's absolutely no, we cannot get you safely on this medication. But if you do have a family history of thyroid cancer and you're uncertain what type of thyroid cancer, again, just digging a little bit deeper into your medical history, we might find that you safely can be on this medication, even if you do have that history. So really the only red flags with this are the pregnancy, breastfeeding, the MTC, that medullary thyroid cancer, and then the endocrine neoplasia syndrome type 2. So, if you look at this list and you're maybe hitting a couple of those and you think that you're not a great candidate for this, at least shoot us a message or reach out, and we can kind of discuss that medical history a little bit deeper and determine whether or not you can safely start this medication. So this is kind of a longer one, but program duration. So when it comes to this program, most people start to see weight loss within about 3 to 4 weeks, but that doesn't necessarily mean that we're going to be anywhere near your goal weight at that point. It is still rapid weight loss, about 1 to 2 pounds a week loss over time. And so the duration is going to range from person to person, depending on what your overall goal weight is going to be. Majority of patients are going to require at least about 6 to 9 months of treatment before we switch them to a maintenance dose, but ultimately the providers are going to reassess your eligibility for medication weaning each time you come in for follow-ups. A common question we do get asked is about weight gain or weight gain after discontinuing the medication. And what we have found, clinical studies have shown that patients are going to be significantly less likely to regain that weight when they slowly taper their dosing and follow a recommended maintenance dose. So we have a very specific plan for weaning people off of this medication that is evidence-based, based off of these studies that we have done to make sure that you are going to be low risk for having rebound weight gain. Another part of that is knowing how long you need to be on this medication. We typically say a minimum of 6 to 12 months on the medication is recommended because that, again, is evidence-based. There's a decreased risk of rebound weight gain whenever you do discontinue this medication. Stopping the medication cold turkey, I highly, highly discourage that. That is associated with a high increased risk of rebound weight gain. It also can make you feel kind of icky because you start to have some fluctuations in your blood sugar regulation because this is working positively towards your blood sugar. So if you stop it cold turkey, the body doesn't quite do very well with kind of managing its own blood sugar. So we always want to make sure we're doing a proper weaning protocol with you. And of course, you got to keep in mind, every time that your body's changing, hormonal changes, menopause, pregnancy, breastfeeding, things like hypothyroidism that you may be diagnosed with after discontinuing the medication. Obviously, those are all linked to increased risk of weight gain with or without this medication. So, of course, it's going to increase your risk of having some rebound weight gain if you were to be diagnosed with any of those things. So, we keep in mind, we tell people as they're getting off this medication, if and when you do need to be put back on this medication temporarily, or if we need to put you on a maintenance dose to prevent some of those things from kind of exacerbating that weight gain, we can definitely do so. But ultimately, to answer this question, because we get it asked all the time, we have lots of things that we can do to minimize the risk of having that rebound weight gain as long as you follow those recommendations.
So more specifically on duration and pricing. So we have 2 separate programs, the semaglutide and the tirzepatide program. All of our new patients get started off with our 12-week program. And that's because, as we've kind of harped on, we have to taper your dose up and then taper it back off. So we have to work your dose up, and 12 weeks is really kind of what we need in order to get to that therapeutic dosing. So for semaglutide, the 12-week program is going to be $1,200 for the program. But we do start all of our patients off with a consultation. That consultation is a $99 visit fee. At the consultation is where we would review that blood work, review your medical history, do a medical exam, and then we'd also talk about both these medications and see which one would be best for you. That 12-week program is going to include all of your medication. It's going to include biweekly phone call follow-ups and then monthly in-office visits. At that monthly in-office visit, we're going to do a body composition scale weigh-in. We're going to make sure that you are losing fat, and we're going to track your muscle mass to make sure you're not losing muscle. You also have the option of getting a lipotropic B12 injection, which, if you haven't had one of those before, they are really good in aiding in metabolism and giving you a little energy boost. You also get membership discounts when you are in any of our weight loss programs. So you get $1 off of any Botox or Dysport, as well as 10% off any injectables. After that 12-week program, you would then be eligible for then either the month-to-month or the maintenance. Month-to-month for semaglutide is going to be $450. That is going to include everything that the 12-week program includes. We just kind of cut out that 2-week call because typically by then we're kind of at a spot where you're feeling more comfortable, your dose is more stable. We really don't need that 2-week call, but obviously we are still available by phone or at any time if you would need us. And then the maintenance program, that is going to be just for those who are wanting to stay on that low dose just for a little bit of appetite suppression and helping to maintain their weight. That's really for those people who have hit their goal weight, have been able to stay on at their goal weight for a while and are just kind of looking to maintain that. For semaglutide, that is going to be $250. And again, that's going to include everything that the month-to-month does, but we just space out that 4-week follow-up to an 8-week follow-up. So we see with you every other month. You still get all of medication that you need, and you still are in with the membership discounts as before. And then tirzepatide on the flip side is going to include everything that semaglutide does for the program. It's just going to be a little bit more. So our tirzepatide is $1,800 for the 12 weeks. It is $650 month to month, and then it is $400 for the maintenance pricing afterwards. For those of you, Taylor kind of mentioned people who might be nervous to self-inject. We do have an in-office injection option that is $50 once a week for whenever if you would want to come in and get your injection from us.
And Caitlin already touched on this a little bit, but you do get some pretty good perks when it comes to the weight loss program, very similar to like our memberships that we have here. But you do get $1 off per unit of either Botox or Dysport. You get 10% off a filler, 10% off a Sculptra. Then we do have our Fit Fusion IV, which we're going to describe what that is here and shortly, and that is discounted to $100. And then you get the other typical member monthly specials. For the week of December 16th through the 20th, we are offering free consultations for our weight loss program. There is normally a $99 consultation fee, and what that typically entails is reviewing or ordering your blood work. Caitlin does a very deep dive going over all of this information with you. She's great at what she does, and she gives you anything and everything that you could possibly need during that time frame. Again, normally that's $99, but we are waiving that. That's free for that week.
So, okay, these are some of our patients that we have seen within the last year, their personal results. So this patient was on tirzepatide. She has been on it for about 9 months, and she has lost almost 70 pounds. The next patient, he is also on tirzepatide. He's been on it for about 8 months, and he lost 80 pounds. And then our final patient here was on semaglutide. She has since successfully weaned off. She was on it for almost a year, I believe, and she lost 40 pounds on semaglutide. Okay, and then we'll segue into IV therapy.
So IV therapy, another huge part of what we offer here at MidAmerica, and how it's going to complement, we're kind of talking how it's complementing medical weight loss, but also just kind of branching into what IV therapy is and the benefits of that. So key benefits of IV nutrients. Number one thing, immediate absorption. A big part of being able to absorb vitamins and minerals, we have to think about the digestive tract. Again, your stomach, it's an acidic environment. Sometimes depending on what you're eating, what you're drinking before or after vitamins can either increase or decrease your absorption. And so you might be taking all the right supplements, you might be eating all the right foods, but your body's not able to process that and absorb all of the nutrients that you're getting. So one big benefit, number one benefit of IV nutrient therapy is going to be it's bypassing that digestive system. We're going directly into the vascular system, rapid delivery, and it's increased bioavailability. Also, obviously, enhanced hydration. We're giving you essential fluids alongside of your vitamins and minerals. We do either normal saline or lactated ringers, very comparable to what your natural kind of system needs. So again, kind of bypassing everything and just giving you that hydration directly where you need it. Also supporting immune function. It's going to boost your immune system, especially during illness or stress, post-surgical, post-illness, kind of helping to get the body back on track. Energy boost. So depending on what we're giving you, obviously, but, we can commonly use a lot of different vitamins and minerals to kind of combat fatigue and increase your energy levels. Not necessarily needing caffeine all the time to make you feel better. Sometimes it's just a nutrient deficiency that's going on, and that's why you're feeling kind of icky and sluggish. And then skin health. Skin hydration and overall appearance is directly correlated to your nutrition levels. So giving you the hydration that you need via IV and some of those vitamins and minerals that you need via IV to help with that as well.
So this is our menu, and I'll kind of go into detail into a couple of these. So the 5 up there are the main IVs, mixtures, if you will, cocktails that we kind of came up with to target certain things. But really the IVs themselves, when you come in, we kind of do a mini assessment and kind of see what you're feeling and what you're needing. And then we can kind of really customize your bag in order to what you need. And we can always add things on into any of the bags that we have. And we'll go into detail of the additives that we have. So the first one I'll talk about is the Fit Fusion IV. So this is the IV that we offer with our weight loss patients. This one is really targeted towards people who want to burn fat, increase energy levels, and boost their metabolism. So it includes 3 different things. So an essential B vitamin mixture. Your B vitamins are going to help. They're essential in converting your nutrients into energy. When you're depleted in this, that can kind of trigger some of that fatigue. MCC B12. So this contains amino acids called methionine, inositol, and choline chloride. Basically what these do, they're going to help break down your fats and aid in digestion to really help with that background with that weight loss. And then the methylcobalamin, that's going to be your B12. This is an active form of B12. So it is going to help you utilize your fats and your carbs for energy. It's important for maintenance of your metabolism, blood cells, and your nerve function. And then the last thing we put in this bag is taurine, which really just helps support your hydration, digestion, vision, immunity. It's kind of really good for overall health.
This is your baby. You can talk about it.
This is my baby. Glutathione. If you have been in to see me for an IV, you know that I harp on glutathione because I love it so much. I call it the antioxidant of all antioxidants. Its key functions, it's going to protect your cells from oxidative stress. It detoxes the body. It helps support your immune system. It helps maintain tissue health. It's involved in DNA synthesis and repair. As we age, our bodies naturally get depleted in glutathione. That can also be for more. It can be exasperated, by other factors like stress, malnutrition, environmental toxins, anything like that. So we need a little bit of a boost in our glutathione to really help our body flush everything out, all those negative things that we don't want in it. It's also going to help recycle other antioxidants that our body naturally has, so like vitamin C and vitamin E. So glutathione overall is just like the best thing that you can give yourself, honestly, as often as you can give it.
And then another really popular thing that we offer is the Tri-Immune Boost Shot. Great for just in general, just this sick season, people getting cold, flu, even sometimes allergies, things that just kind of make you feel icky this time of the year. So ascorbic acid, vitamin C, the bioavailable natural form of vitamin C that's supporting cellular function and going to help with both the innate and adaptive immune system. Zinc sulfate, another huge one for immunity. It plays a role in the development and function of immune processes. Supplementing with this mineral, it's going to help combat infections and aid in wound healing. There's also been studies that have shown that zinc early on in cold or flu can shorten the life of your cold and flu. So definitely great for helping to boost immunity. And then, of course, the favorite of Caitlin here, the glutathione, again, protecting your host immune cells. It's providing optimal functioning of other cells in the immune system. So this is offered as an IM shot. You can come in just when you're here for your weight loss visits, when you're here for any other spa services we offer. Quick and easy, takes us less than 30 seconds to inject this, very quick. We can also add it into an IV as a booster to your IVs as well.
So coming soon, with all that being said, so we are going to be launching some new wellness memberships in January. We are still tweaking, fine-tuning the details of these, but they're going to include at least one IV a month, 1 or 2 a month, depending on which membership you choose. And that's going to be paired with some of the skin services that our esthetician Maddie offers. So keep your eye out for those because we're super excited to get those launched and going.
And who doesn't want, while you're sitting in here, getting a nice pampering, getting a facial, you can also be getting nutrition through an IV, just quick and easy. Caitlin's great at what she does with starting her IVs too. So she does a great job with that, quick, painless, and you're going to be feeling great, looking great. So we're excited about it.
Q&A. So I think if anybody has any questions, we will take those now.
Yeah, so Kate, hopping back on here, it looks like the first question we received was during your semaglutide and tirzepatide talk. The question is, how important is protein intake on this medication, and how much protein do I need?
I can take that one.
Yeah.
So we talk about this a lot in your consultation. Protein, I feel like has more and more just been coming out of how important it is for weight loss in general. It is going to help keep your metabolism running. It is going to help keep your lean mass, muscle mass in your body. I typically tell my patients, I typically tell them to shoot for 0.8 to 1 gram of protein per pound of body weight. That is a higher goal. But however, if you're not somebody who kind of currently tracks protein, it's not something that I tell them to stress out about. Typically, I'll say, we have you try to eat small, frequent meals throughout the day, every couple of hours. So making sure you're getting protein in each of those little meals throughout the day is really going to be beneficial for your weight loss. One, while you're losing the weight, and then two, for keeping it off after you're done.
Okay, awesome. Oh, sorry, go ahead.
No, you're good.
All right. It looks like the next question I was going into is related to medical weight loss also. And the question is, how do I know which medication is the right fit for me?
I can talk about this. So when it boils down to medical weight loss, semaglutide, tirzepatide, they're both GLP-1 medications. They're both going to work in the same manner to some extent, but GLP-1s, again, kind of primarily focusing on that appetite suppression. Tirzepatide is a dual action peptide, and so it's working to kind of help with additional digestive secretions as well. And so what we notice with tirzepatide, people tend to lose weight a little bit faster with less side effects. So I will say just off the get-go, tirzepatide is my favorite of those two medications. I do see significant differences in how my patients tolerate the medication. And I do think that the weight does tend to fall off a bit quicker with the tirzepatide. Now, that being said, I do always know that budget is something that we have to keep in mind whenever we're doing this medication. And I think semaglutide is still a fabulous medication, and it is a little bit more of that cost-effective option. So, ultimately we have this conversation when you come in person. We talk about just in general, your health, your medical history, how you tend to tolerate medications. If you're someone that maybe doesn't always react well, you get a little nauseous whenever you take this, that, or the other, that might be something that we want to keep in mind whenever we're prescribing you a medication. Again, the side effects still incredibly manageable no matter which medication we put you on, but you do have a slightly higher risk of having some of those GI belly upset kind of side effects with a semaglutide in comparison to the tirzepatide. And that's just ultimately because of how those two medications are working and the slight differences in their chemical breakdowns. So ultimately, I think it's just a matter of having that conversation with you when you come in for your visit and determining which is going to be the better option for you.
And speaking of the medication, we received a question. What if I'm going out of town and the question is, can I get my medicine to take with me?
Yes. So whenever you come in, you'll get 4 weeks worth of medication at a time, prescribed to you, labeled appropriately, all those things. The medication itself, like we talked about, you take it once a week. That does have a little wiggle room to it. So you can take your dose either 48 hours before or up to 48 hours after your scheduled dose day. So you'll always have everything that you need. And if you're going on a trip, don't want to bring it with you, then you'll have it, take it right before you leave, take it as soon as you come back.
Okay, awesome. So that kind of rounds out our questions around medical weight loss. It looks like the next one is going into IV therapy. Question is, what all does the B12 do? How do I know if I need an IV instead of a shot?
That's a good question. I can kind of touch on it a little bit. So the B12 itself is kind of a metabolism booster. So that methylcobalamin is something that I think the statistic is about 85% of people in America are deficient in B12. And so that methylcobalamin, that is specific. That's that most bioavailable methylated version of that every body can well break down and metabolize. There are other types of B12s on the market. A lot of the common ones that if you're taking it orally, cyanocobalamin is another really popular one. Not every single person can break that down. There are different, kind of going into branching into other things here, but there are different genetic mutations and genetic differences that make people either able to process that or not able to process that. So we specifically offer only that methylated version that 100% of people find bioavailable and able to metabolize. Shot versus IV, ultimately, to some extent, it's personal preference. Giving it in a shot, it does tend to kind of stick with you a little bit longer, but IV, it's immediate. It's right there. It's in your system. There's no environmental factors that are going to change whether or not you are breaking that down. A big thing too is like what I was talking about earlier, the GI system, your belly, your gut, it's a very acidic environment. And so depending on what you're eating before, eating after taking a supplement or eating something is going to depend on how well you're able to absorb it. So bypassing that by either giving it in a shot or giving it in an IV is going to make sure that you're able to absorb 100% of what we're giving you. The IV has the added bonus of giving you that hydration. So you're getting other things mixed in with the active ingredient, that B12, compared to the shot is just strictly B12, and again, we have the lipo B12, that's that MICC. So it has the inositol, choline, all those other ingredients as well, which we can add to your IVs. I think the big difference between whether you should do IV or shot is one, time, because an IV takes about an hour or so to infuse. And two, if you're wanting the extra bit of hydration, if you're feeling a little dehydrated, if you've had a couple headaches, if you're having some of those other side effects like nausea or constipation, the IV itself can also help with a lot of that. I think, did that answer that question?
I think so.
Okay.
I think so, yeah.
I feel like it did. That was a very good question to ask also. Final question is, are the IVs good with helping most of the medication side effects?
Yeah. So, like I said, the side effects of, I'm assuming semaglutide and tirzepatide is what we're talking about, but the side effects of them tend to be pretty low, but IVs themselves, they can help with, like Taylor has said, that initial hydration is kind of key. A lot of patients who end up feeling side effects a little more are those who are not either drinking enough, getting their protein in, things like that. And so getting that direct hydration into your body really helps boost the system initially. We also have some other add-ons that we can help give you, or we can give you if you're feeling nausea. We do have a Zofran add-on that we can give you just to kind of help with that nausea. That's really it. Yes is the answer.
Yeah. And in addition to that too, not only helping with side effects, but also enhancing results of the weight loss medication, because again, a big component of this is your nutrition levels and your health are going to be incredibly indicative of how well you tolerate the medication and how well you lose weight when being on the medication. So if we can make sure that we're keeping your body well nourished during this time frame, especially since you're going to be having a decreased appetite, you're intaking less food, and there might be a little bit of malnourishment if you're not being very cognizant about what you're eating. And so we're just offering this as another way to make sure that we're just looking at you as an individual from a holistic perspective and keeping you as healthy as possible while you're on this medication. So that way your results are the best they're going to be, and also just that you're going to feel the best that you can while you're on this medication.
Great. Well, that was awesome information. Thank you both, Taylor and Caitlin, for answering all those questions for our viewers. If we can go ahead and just head to the next slide, that's where everyone will find our contact information. Please feel free to reach out to our office for any follow-up questions or additional information you have about either medical weight loss or IV therapy options. That does conclude our webinar, and I wanted to thank everyone for joining us today, and we hope you were able to gain some valuable insight into some of our wellness options here at MidAmerica. On behalf of the team, we wish you all a happy holiday season. We hope to hear from you soon. We encourage you to follow us on Instagram at MidAmerica Med Spa. This is a great opportunity to kind of keep up with the team and also follow updates on the memberships launching in January. So again, thank you to Taylor and Caitlin, and that concludes our webinar.
Thanks,
Have a great day. Thanks.